Welcome back to Hot Flashes and Cool Topics, everybody. We are really thrilled today to have Dr. Zoe Martinez on. She is a psychiatrist. She also has worked with not only children and adolescents, but also in adult psychiatry. So, this really gives her a really great look into what we're going to focus on today, which is ADHD, specifically in adults and really in women, since most of our audience is women. So thank you so much for coming, Dr. Martinez.
My pleasure.
I thought maybe the best place to start would be, can you just talk about what ADHD is? Because we're going to talk about, having diagnoses later in life of ADHD.
Okay, so in general, it is a mental health disorder. So attention deficit hyperactivity disorder. Sometimes people still use ADD, which is not an official term anymore. But it does describe one of the cardinal symptoms of ADHD, so attention deficit hyperactivity disorder, which there are three major components of that. One is inattentiveness and everything that goes along with that. So having difficulty focusing during, it could be a boring meeting, a conversation, being easily distractible, having trouble organizing or staying on task. So all of those things that have to do with inattentiveness. Hyperactivity is more the motorically manifestation of that, being having a hard time sitting still, kind of twiddling, doodling. Like those are the things we see more in kids, and we especially see more in males. So we know that males even in childhood are more likely to get diagnosed because they're the ones that are like running around the classroom, climbing on things, having difficulty like just being able to be still. Which is different than not being able to focus. And then impulsivity goes along often with the hyperactivity with kids. This is often more in children seen than in adults, like running out into the street without looking, like all the things that make jumping off the monkey bars. Those are you can see some of those features in adults, especially if they're, in conjunction with other mental health disorders. But I would say, since we're focusing mostly on women, the biggest subtype of ADHD that we see in women is the inattentive type, which again, it used to be called ADD. And that can lead to a lot of problems with succeeding in school, succeeding at work, sometimes succeeding in personal relationships when another individual doesn't feel like you're really listening to them, because the truth is you aren't. And if someone talks too long, it's like, what? And it's not out of rudeness, but it can be perceived that way. So that's but because it's kind of the quiet symptom of ADHD, we find a lot of girls, especially intelligent girls, don't get diagnosed until they kind of get to a point in their schooling or their career where their inattentiveness and ability to focus can't be overcome by their, by the other tools that they have, like their IQ, they're, making schedules for themselves, other things. They're having trouble. They're starting to not pay attention in meetings. Maybe I actually have a very dear friend who kind of got to a point in her career of being an advancement, very intelligent person. She's just like, I cannot sit through these meetings. And she didn't literally mean she couldn't sit, just she wasn't absorbing anything. So she's like, I hope no one looks at my notepad, because I'm like seriously doodling on it instead of taking notes.
Yeah, I can imagine. And organization, I can see just as you get older and you're trying to keep up with your things. Maybe when you were younger, you had a parent there that was trying
Right.
to help you. But I see it in myself a little, which I really would like to take that test that's on the done site. But I see organization as a big thing. What are some things that adults can do? What I know that you say the number one thing is really medication is very helpful. Are there other
If,
things as well?
if you have that diagnosis, and then I think because this kind of ties into what you guys wanted to talk about, so I might be jumping ahead, but you'll
Right. Like,
edit it.
can you first talk about what traits women have specifically in midlife that can be attributed to ADHD? And then we can
So,
get into the medicine.
sometimes hormonal changes. So an individual that doesn't have a prior ADHD diagnosis or doesn't have prior ADHD symptoms. So one of the things that happens in menopause, for example, or perimenopause, is that levels of certain neurotransmitters, including dopamine, which is one of the ones that really drives us and helps us to focus, can go down. And that can lead to problems with memory and concentration and appearing to be forgetful. And that can be like a new onset thing that happens as a result of hormones. People sometimes describe that in menopause, but also sometimes people have described that, women describe that when they're pregnant, they have pregnancy brain. They misplace where they put something like, why am I in the kitchen? Like, and it fortunately in pregnancy, it's usually temporary once you start to sleep again. But in menopause, also there are disruptions in neurotransmitter cycles so that you can see things that look like inattention, forgetfulness. Those are probably two of the big things. And they may be a resurgence or an exacerbation of ADHD symptoms in someone who already had ADHD, but it could also just be hormonal changes related to, that changes in neurotransmitters in your brain going down. And so this could be someone who never had ADHD before, but is somehow finding themselves having trouble paying attention in conversations, being forgetful about where they put things. And we all misplace our keys sometimes, for example, but like really doing that a lot. Some things that are less characteristic of ADHD, which would be, for example, word finding difficulties. That's not usually a symptom of ADHD. That's more probably a symptom of the hormonal changes. So a different kind of forgetfulness. And it can be hard to tease that out if someone hasn't had a diagnosis of ADHD already.
The hormonal changes, it's so interesting. I'm just kind of, as you're saying this, thinking through my mind, just personally, that once I hit puberty, like I was like, woo, I was on fire as a child, like school wise, hitting puberty, it became more difficult. And then, I got myself back in gear. Then when I went through menopause, just the whole brain thing, trying to remember things. And I'm thinking, this is really something. I never really connected it maybe with hormones. Do you find that that's something in adolescence or just any time that a person goes through a hormonal change?
Yes, I think that because until recently, specific focus on women's health in this way, like neurologically, wasn't really focused on women or just, whatever emotional or crazy or whatever, whatever term that they get, So during PMS, for example, people who have more severe PMS can also find themselves both more emotional, but sometimes also more forgetful. And then if you don't attribute it to just, okay, this is normal, these are hormonal changes, like so menses, pregnancy, menopause, those are times of significant hormonal changes. And it helps sometimes to know, hey, okay, this might not be when I'm at, I hope that I'm not having a debate this week because it might not be when I'm at my best. And then just, either doing something which, sometimes for younger people can be taking hormones even to help them control some of those symptoms, to just have a more regular, like where our hormones aren't fluctuating as much. Or if, again, it's hard because it could be that you're unmasking ADHD. So it's difficult sometimes. The most important thing though is to be really non-judgmental with oneself, to just notice things as much as possible, like kind of like you were on a fact-finding mission, like, okay, it seems like in the past week, like, or once a month, I have this problem, or now that my body's changed and I'm pregnant, I have this problem, or now that I'm starting to see changes in my cycle and other things, I'm noticing these things, and then to talk about them with a clinician that you trust without judgment, and someone who has the time to talk to you, so that they're not just like, oh, okay, let me just give you a prescription and get you out of here. Like, hopefully help you understand and help you make an informed decision about what's the best way to manage these things, because they're not, quote, all in your head. They're real neurophysiological changes.
I wanted to throw out a few of the statistics that I actually saw on the Dunn website, and we'll talk about Dunn in a few minutes. But it says that 75% of ADHD in adults goes undiagnosed, and that 50% of women are less likely to get diagnosed. What do you attribute the diagnosis dilemma, for lack of a better word, for women? What do you attribute that to? That we just kind of write it off and keep going with our day? Or what would you
So
say?
yeah, I think that's a good way of describing it. So first of all, like the overall percentage of people who aren't diagnosed already, like males and females as adults, is high because, as I said, they often have other coping mechanisms depending on your age. So children now are probably more likely to get diagnosed because it's become more socially acceptable. But if you're talking about women in their 50s, it was more taboo to even bring up those kinds of issues, especially if you just had a little girl who seemed like she was, quote, daydreaming a lot in class. That wasn't enough for anyone to think that they should bring their child to a doctor and maybe even talk about medicine, never mind talk about. So a lot of people just kind of grew up saying that she's flighty, or she daydreams a lot, or and that little girl figured out, and then young lady figured out, and then woman figured out a way to kind of get through it and to manage, like, which without thinking that, hey, maybe there's something wrong. And I would say that although typically adult males don't have the same degree of hyperactivity and impulsivity that they would have had as children, some of them, when they reflect back, they realize some of them were actually diagnosed, or something was picked up in childhood, even if it wasn't treated. So they're like, oh yeah, I was always the class clown, or I was always doing something that attracted their behavior, attracts other people's attention. And I think women culturally are encouraged to, whatever's going on in your head, you're just supposed to keep it quiet and just kind of blame yourself, whether it's a hormonal change, or whether it's having ADHD symptoms, or whether it's, having anxiety. So a lot of women grow up feeling like maybe they're just not that smart. Well, I'm just dumb. This is just me. I'm not good at these things. So they don't really complain about it. And then sometimes something happens that exacerbates the symptoms enough. Whether, again, it's a more challenging position at work, or I think having to for COVID, I think actually brought this up for some people, having to work from home, where you didn't have your office and there were more distractions, and maybe you have kids or a life partner or something, and other people, like, it's not your office, and you're having to pay attention to multiple screens. So I think that was also one of the things that maybe happened for some people with done it, just saying, I literally can't do my work when there's, like, I've got like 8 screens open, and like my kids are asking me for a sandwich or whatever, or to fill out some form for school. It's like I can't get things done anymore. So I think we saw an increase in women saying, I think I've had this my whole life, but I never asked for help.
Yeah, you also brought up the stigma that goes with that. And I'm a former elementary school teacher, and, people are very terrified, that we were told, don't you tell this parent that their child has this, because we were not clinicians and we didn't have a test to do that. But we would, suggest perhaps you want to speak to your doctor. And boy, you talk about getting a parent upset, very quickly. And I think that it was because of the stigma. It wasn't that their child was unlovable or anything like that. But can you talk a little bit about the stigma behind ADHD?
So I think, unfortunately, like a lot of mental health diagnoses, rather than people seeing it as an illness, like, if someone has allergies or they have diabetes or something, you just think, well, of course, I'm going to get them treatment. Because it's a mental health thing that, like, occurs in this mysterious organ of the brain, there's a lot of stigma about, like, well, it's your fault, or it's in the case of children, it's the parents' fault. They must not be raising them right, or the kid's not trying hard enough. And that, unfortunately, when I work with parents, because again, I'm board certified in child and adolescent as well as adult psychiatry, I often tell them, like, untreated ADHD often leads to other things, like sometimes depression and anxiety disorders, because this kid grows up thinking that either they're lazy, they're stupid, they don't have enough willpower, like, so that basically if they just had the will, they could overcome these things, instead of seeing it as, okay, it's a brain illness. It's a very treatable one. It's not severe. It's not, but I think you're right. And, I think elementary school teachers probably are some of the best, like, in terms of helping with the diagnosis. So we actually, when we treat children, when I have treated them historically, but also on the Done platform, we actually ask both a parent and a teacher or some other person in the child's environment, or youth, I guess, up to through teenagers, to say, hey, what do you notice? So that it seems more objective, and you're not just saying, hey, I think there's something wrong with your kid.
Yes, yes. And, that also leads to, if they aren't diagnosed as children, that could lead to other, like you said, psychological things when they're adults. Just, the whole trauma of maybe
self-medicating and things
yes,
like that.
self-medicating, and even this, like, almost a depression, like you said, or anxiety, that everyone thinks I'm stupid. Everyone thinks I'm different,
Or even worse, I am stupid.
Yes,
Like,
yes.
Like
Yeah.
really believing that, like, well, everyone else can do this and I can't, so there's something wrong with me. So like, and then not complaining about it. And so that's, I would say, the stigma in getting treated as an adult for the first time is really hard, because and it has been made more difficult to some extent by some of our, I'm not going to talk about politics, but just some of the regulations about controlled substances. So if you have a clearly established diagnosis, which is more likely to have occurred if you were male than female, it's easier to, if you meet with a clinician, they say, hey, I think, for example, a stimulant medication, which they are controlled substances and one does need to be careful, but it might be helpful for you. And in an individual who does not have a history of substance use disorder, it's completely appropriate to treat them with one of these medications. However, because of, there is a cultural stigma not only about the diagnosis, but also about, oh, you can't take addictive drugs. Well, the truth is these drugs are addictive if taken improperly or by people who don't have the diagnosis. So we don't have those issues, and people who are correctly diagnosed and take their medications as prescribed, we haven't had problems with that. It's certainly possible that someone, takes someone else's medication, and that's not okay, and that certainly happens, and that's a society we live in. But I think that it's become a stigma also about, oh, I'm taking an addictive substance. Well, yes, but many effective medications could potentially be addictive if used in the wrong manner. So that's the second part of the stigma. So one is having a diagnosis, oh, there's something wrong with me. And all mental health disorders get thrown in that, like, you should just will yourself out of them. And then the second problem is that the most effective medications for ADHD are usually stimulants, which are controlled substances. So then it's like, okay, so there's something wrong with me and I'm a drug addict. So two categories of people which frequently are, stigmatized.
Mm-hmm.
I have a daughter who was diagnosed as an adult with ADHD, and she went through the testing. And I know that we've had a discussion recently about the stimulant shortage. Can you talk? I know that a lot of people are struggling with that. Can you talk about that?
Yeah, so I think there's a couple components of it. I think one of the components is a genuine shortage. So that I'm not sure if there was a particular company or a couple companies that just weren't manufacturing enough. But I think that the other is that for some of these medications, they're not terribly expensive, which is a good thing. But that means that when there's a shortage, there's not a lot of pressure for another company to kind of make up for the shortfall. And then in addition, I think that there's sometimes pressures on some pharmacies, sometimes blatant and we know about it, and sometimes it's just sort of this kind of like, well, if you hand out too many stimulants, you're going to look like, a pharmacy that's doing that too much, like your drug pushers. And that's something I think, truthfully, that Dunn has also been, accused of, like, we're just like trying to get people on addictive drugs, and that's not true. And I think some of this comes out of the opiate crisis. And stimulants are not opiates. I'm not saying they can't be addictive, but we're really talking about a different thing. So kind of a lot of this is kind of coming together. So there is a shortage, an actual shortage in some areas of certain medications, but also there's not really a political will to, push this. It's not like a COVID vaccine, for example. So everyone's like, well, there's still that stigma. Well, just have a cup of coffee and just make yourself, do this. It's not a real problem.
What do you find of drugs like Strattera? That are they non-stimulant? Because I have a child also with ADHD, so we've kind of,
and our children are adults, so when
they're adults now, yeah. But
yeah,
he was a child when he was diagnosed. Yeah.
So I think Strattera for some individuals works really well. The downside of it, I would say, both for, like, it depends on how much access you have to your clinician, is that Strattera, in terms of its mechanism of action, can take a little while before it works and before you can get the right dose. So one of the good things about stimulants is that you pretty much know right away, good or bad, like, wow, this made my kid like not able, or I can't eat, I can't sleep, the side effects you're going to have right away. Where Strattera, it's more of a commitment, and it's a slow process. And it's hard for people sometimes to take a medicine every day where they're like, I can't really tell what it's doing. So that requires that they have ongoing treatment with a clinician who can say, okay, well, you might not feel different, but let's go through what things were getting in your way before, and then it's like, oh, actually, I guess I am doing better. And this, I mean, I've had people that even say like, yeah, I'm doing better at work, but also like, people on my softball team aren't yelling at me anymore for like, zoning out, not really paying attention to the play. So, and that might sound silly, but if it's part of someone's social life, that's important.
Absolutely. Psychologically, it is,
Yeah, to feel like, because when other people feel like you're not paying attention to them, they can misinterpret that as you're rude or you don't care. And so that affects personal relationships. So it's not just about how well you perform. Obviously, that's important, and that's how most people need to do some kind of task in order to get reimbursed for it and survive. But also, it when people feel you more present, I think that improves social relationships. And I know for sure in families when they're getting their youth treated, they're like he listens to me. So obviously sometimes kids don't want to clean their room and stuff like that, or someone might want, I mean, I have my office is not the perfect tidiness. There are definitely tasks I postpone, but I'm choosing to postpone them. It's not because I literally forget. And so when I have the ability to like organize things, that helps, and it makes people feel like you care more, even though you may have always cared the same, but it was just literally impossible to try to keep all those things in your head and organize them. I would say that you didn't ask specifically about this, but one of the things that sometimes happens to some women as they go through menopause is that their sleep cycles get disrupted, sometimes by hot flashes, just sometimes by their changes. The hypothalamus, which is involved in temperature regulation, is also a component of like helping with circadian rhythm. So that also gets disrupted. And so if you add not paying attention very well and not having a very good memory to also not getting enough sleep, whatever symptoms were there sometimes get more uncovered. So I think there are many people that would say, well, why on earth would a 50-year-old woman need to get diagnosed and treated for ADHD? Well, I would say probably she had it her whole life, but until all of these things, it was just too many, like the straw that broke the camel's back. So it doesn't mean she didn't have it before, but she found ways to cope. And now you add this one more thing and it's like, okay, now things are falling apart. I'm forgetting to pay bills. I'm forgetting where I put things. I'm forgetting appointments for myself or my, significant others in my life. And that's not me.
Right. So if a woman, in her 40s plus decides that, I think I might have ADHD, I wanted to ask you, one, what is the testing to get diagnosed? And two, you work with a platform called Done. How does it work with them to get someone diagnosed? So if it's the same testing, I guess that would be the same
So
answer.
there's no, I mean, there's kind of one standard. It's a self-rating. For adults, it's a self-rating scale. We don't have, there is an adult Connors, which we sometimes use for kids, but mostly there's one, and I've worked for a number of companies that it's a self-rating scale for ADHD symptoms. And then in addition, for Done, at least, people also fill out some information about like medical history to know, for example, if there could be something else going on. So for example, if someone has a seizure disorder or had a traumatic brain injury, some of their symptoms might be, so they might have some of those symptoms, but they might be due to something else. So that's the first step of the process, is someone says, hey, I'm interested in finding out whether or not I have this, and all of that information. So a lot of self-rating skills and and information that people provide, that goes to the clinician. So the clinician has that all ready for the first appointment, so that we try to make appointments more like efficient and personal. So the rating scale parts are already done. We also do screen in adults for anxiety and depression, because some of those symptoms can overlap with ADHD. And many of our clinicians will be treating someone for more than one issue. So they may have ADHD, but they may also have anxiety or depression. And all of those things are common problems and easily treatable. But we try not to make the person take up their time with the clinician by like filling out rating scales. So it's all front loaded, so the clinician can look at all that stuff before they see the person. And then hopefully most of the interaction is having a conversation, whether that's about symptoms, or sometimes people are themselves, because of things that they've heard. They think a medicine might help them, but they're like, I don't want to be on something that's addictive. I've heard, these horror stories, so whatever, it's much more tailored to what the individual desires and has questions about, so that we don't have to do the screening as part of the one-to-one interaction with a clinician.
Time well spent. Yeah, it sounds like
Yeah,
time
yeah,
well
yeah.
spent.
So
Yeah.
we already have a pretty good idea that the person seems like someone who, we don't know 100%. So go through and verify those things. But yeah, but hopefully that way then, and then we also, I mean, really, I think most of our clinicians really like to give an individual chance to ask questions about what their particular concerns are, or, and what their schedule looks like. Like if they were to take a medicine, what would be the best, like what makes the most sense? What does their sleep schedule look like? So we talk about kind of nutrition and like sleep hygiene and those kinds of things as well, because having an overall like good baseline of mental health wellness helps. So like, are you doing any exercise? Do you take any time for yourself? So, because sometimes people have unrealistic expectations. It's like part of the reason that you might not be able to pay attention is that you literally have too much on your plate. So what's in your support system? What can we offload maybe to other people?
I noticed too on the DOME website that it is offered in a lot of states. I
Yeah.
tried to count. I think it was 37, but
Yeah.
I was
Oh, that's
really,
even more than I was going to say 35, but yeah, it's a
but
lot of
I,
states. Yeah.
I was just counting on the screen, but
Okay.
I was really pleased to see that, because I know that people are really, especially since lockdown, telehealth has become much more prominent, but you run into a problem where a lot of people can't practice in certain states. And I was really pleased to see this. It's offered in a lot of states. And also the prescription program, you can do prescriptions, but there's also delivery. And I can't remember, it was about maybe 5 states, 4 or 5 states.
Yeah,
where you
and
can
that's something we're always working on to try to help people, because even if you are in a state that has a provider, there are some states like California and Texas, for example, that are relatively large. So sometimes it's, even if you could find an in-person person, you're talking about sometimes like a 2-hour drive each way. So versus being able to see someone in your home or your office or wherever, where you're not spending all of your time commuting to the doctor's appointment. So it's hard to find clinicians. And then, for some people, again, if you live in a large state, you might be spending a lot of that time driving to and from appointments. So really, we're really trying to increase, like, accessibility is a very big part of what Den has tried to do, is to try to make it easy for people to, because it's hopefully a personal interaction, even though I think because of COVID, people have gotten more used to talking to people on the screen.
Right.
So it feels personalized, it's one-to-one, it's tailored to you. You have also someone that you can send messages to, like if you do try something and it's like, hey, this isn't working, or so someone can make adjustments even in between appointments. And we really do try to foster a lot of that communication as well. And you really feel like you have someone on your team, because I really feel like that's how your mental health clinician should be. Like, I'm on your team. It's not my goals. Like, there's nothing quote wrong with you, but there are ways you want to optimize your life, and I'm here to help. And I hope that doesn't mean driving, 2 hours to talk to someone for 15 minutes, which unfortunately is the way a lot of traditional healthcare is. And it's not anybody's fault. There's just not enough clinicians. So
For women who don't want to take medication for whatever reason, they are taking other medication they don't want to add on, or you talked about sleep hygiene, you talked about diet and exercise. Is there anything else that they can focus on? And I guess focus is no pun
It's hard.
intended.
Yeah.
That they can do to help get organized or help them focus better?
So I would say that once someone knows they have the diagnosis, even if she or he, but we're talking about mostly women, so she elects to, like, saying, I don't want to go the medication route at this time. There are actually, once you know you have that diagnosis, there actually are a lot of sites that support doing things, many of which some of us already probably do for ourselves, but like to make a calendar, to try to have your schedule as regular as possible, to have, like, I have sticky notes on my computer for the things that I know I need to look up frequently, or to put reminders on your phone, even if it's to, like, take 10 minutes and go for a walk. Like, so I think a lot for people with ADHD, even without medication, a lot, like, having the most regular schedule you can have is the best. And then also kind of sharing that information with family and friends. So for example, family gatherings can be stressful for people with ADHD if they're very large. So even just if there's a couple people in your family, say, hey, if I need to step outside for a minute because I'm like, and that it won't be seen as rude. So just, revealing and getting a little bit of support, even if it's without medication, just say, I might need to take a time out, like just to, regroup, and I'm not being rude. But sometimes, multiple conversations, even if it's with family, in a safe environment, that can help. Also, obviously, around the holidays, encouraging people, like, I mean, if you're going to have a glass of wine, that's fine. Maybe don't have more than one, and just be very aware of your surroundings, because that just makes whatever mental capacity you have, can be a little fun, but also can potentially impair that. So just really making conscientious choices, which don't have to be medicine, but just kind of accepting the diagnosis and accepting that because I have this, I have to be a little bit more careful. And like I might need like 5 minutes to like clear my head before I drive my car home, for example, because I've just had all of this, like there's a lot of stuff. So just, personal health, safety, and like hopefully being able to tell at least, a friend, a partner, a loving family member, this is what's going on with me. This is what I'm doing about it. It would be great if I had your support. So feeling supported and like, I do have this issue, but I'm taking care of it. And yeah, it doesn't always just have to be medicine. And there are support sites. So NAMI, which is National Alliance for the Mentally Ill, is a great kind of peer and family support. So they have something specific for ADHD as well. There are other websites, but that's definitely one of my favorite, to kind of get some coaching about like, what do you do? Or, hey, maybe I want to go back to school. So I guess people don't think of this necessarily, but I might be 50 years old and decide I want to take an art history class. Like, how do I go about doing that? And it's possible even at that age, even if you're going to community college, to qualify, for example, for if you meet with the Students for Disability office, like I might need extra time on a test, or I might need to send it in the front of the class. We really try not to get in the way of what anybody wants to do with their life, and just encourage them to say, hey, this is something that I'm struggling with, but it isn't me. Like this doesn't define me. It's just something I need to pay attention to.
What about employment? Is there anything that someone who is diagnosed with ADHD can talk to their employer about? I didn't know if there were any laws in exist.
Accommodations
Yeah,
or
accommodation. That's a good
So,
word, Colleen. I
so,
can't get it out.
accommodations.
Yeah.
Definitely the Americans with Disabilities Act does cover accommodations. I see people using these more in school, but I would certainly encourage anyone, I mean, probably to have a confidential discussion with someone, and if their company is large enough to have an HR department. But it is covered. I mean, but the first thing is the person has to accept that and I hate that, it's called disability, but that is what the legal act is called, the Americans with Disabilities Act. And so, but as ADHD is covered under that. So I would encourage people, and I think, it probably depends on your state and your specific industry. But if you are a company large enough, an HR department, I would say, I mean, it is a legitimate disability, and there may be accommodations that can be made. Again, it's going to depend on the kind of work that you're doing and the state that you're in. But I would definitely, you should not get in trouble for that. And if someone does get in trouble for revealing that information, then that company is in violation of the law.
I was just going to say, do you notice some of the adults that come in to get diagnosed with ADHD discover it because their child was diagnosed, and all of a sudden they're like, wait a second, that's me?
Yes, that's actually happened not only to patients that I see, but also even to my friends who I'm like, you might want to get your, and they're like, oh, so yes, one of my very dear friends from medical school, like her husband is very successful, but once their daughter got diagnosed, it's like, like, and she was like, honey, I've always known that you have ADHD. We just kind of didn't talk about it, but I think that when parents are saying, when they're able to accept that maybe their child needs treatment, it's like, oh, I think maybe you got this from me.
Yeah. Yeah. I mean, I actually think that myself. I think about it myself. I really do. And, I'm curious, has there ever been any kind of concrete or any kind of scans or studies done on the brain to figure out why ADHD occurs?
So, I mean, so there are people that have done, I think, mostly SPECT scans, because they're not, they're kind of not that invasive. But it basically just shows kind of what I talked about, which can happen in multiple states. So not specific just to ADHD, where the neurotransmitter levels are a little different than what you would expect in a quote neurotypical person. And some of those things can be tested during performance of certain tasks. But I mean, in terms of why we have ADHD, I think that's probably beyond my pay grade. But I could argue it's the same. Like, why do we have mental health, issues at all? And my guess is that we don't know exactly how genes work, but it's entirely possible that some of the things that sort for ADHD or even more serious disorders like schizophrenia or bipolar disorder, maybe they're close to genes that help with creativity. There's a reason that these things get preserved across cultures and across, so it's not, it's not a detriment. So I don't think anyone knows exactly why we have ADHD in our population. I think it seems like there's an upsurge, but really it's just an upsurge in diagnosis. It's not like there was a virus that caused everyone to have ADHD. But my guess is it probably co-sorts with some beneficial mental traits, which again probably include flexibility in thinking, creativity, like other things that we want human beings to have. It's just when it gets, to a point where it's disruptive. And the truth is that many of our work environments are not idealized for creative individuals who may want to work like different schedules. We have a very regimented kind of I think COVID actually helped a little bit with that in some ways, made some things worse because it was more distracting. But I think that there are a lot of people, for example, that are not really looking forward to going back to their offices because they've been able to find work schedules that work better for them. And so I think we are, many cultures, but I would say definitely the American puritanical culture of the sort of like working from this time to this time with this much of a lunch break isn't optimal for lots of people. But I think we do want people to be, again, creative and enthused about different things, and even maybe to have, more energy at certain times. So people who work on projects. So I think outside of certain industries, so in tech, for example, in more creative fields, I think that ADHD might even be an asset for some people. So so it kind of depends on what kind of job you have. It's not always a detriment, as long as it's so that basically that's also what we talk about. It's like, if you just want to know whether or not you have ADHD, but it's not hurting you, then we wouldn't probably recommend you get it treated, just that you're aware of it and that you pay attention to, is it causing problems in my life? If it's not, it just can be part of your personality and it's fine, as long as it hasn't, caused any kind of poor self-esteem or any kinds of other issues. So.
And that's interesting because, like you're saying, if it's not affecting your ability to live your life, then it's just a factor. It's just something to know and maybe make accommodations in your own personal life for that. A lot of people don't want to have to go to a doctor to get a diagnosis. Can you talk a little bit about Done, what it is, and why it was created?
So, the founder of Done created Done basically to try to help people access care more readily. Most of our clinicians are actually specially trained nurse practitioners, so they are PMHNPs. So they are maybe more approachable than doctors. They are people who can prescribe medication, because a lot of people, that is what they're looking for. So right now, Done does, depending on the state, there are some contracts with therapy groups. If someone just wants a referral for therapy, so they can go through the process and then say, hey, maybe you want to work with a therapist, especially if seem like there are other issues that might be more pressing. So sometimes someone goes through the process and it seems that although they may have ADHD symptoms, what's really causing them to have issues in their life is more of a depression, and they don't necessarily want medicine. So we really try to do as best we can a thorough assessment in a very non-threatening environment, which I think, again, especially with COVID now, people got kind of used to seeing people on the screen. So they choose their environment, they choose their time, and it's not the same thing as going to a traditional doctor's appointment. So there's a lot more, I think, flexibility, so people can sit in the space that they want. I have met with many people who have their pet with them, which, that also basically it's kind of like the person chooses what environment that makes them feel comfortable. And they are having a personal interaction with someone who, is mental health trained, whereas a lot of people may have very good relationships with their primary care physician, but they weren't specifically trained in mental health. And so, and they tend to have a format of kind of like, good, working on checking your blood pressure, checking on your blood sugar, those kinds of things that are more like algorithm based. And we find that mental health treatment needs to be a little bit more flexible. So we hope that that the barrier to entry is lower, including the sense of stigma that you really feel like, hey, I can, like I said, I can have my dog and cat with me and sit in my bedroom if I want to, like, so where I feel comfortable. Or sometimes people, whatever, they're waiting for their kid to be at a ball, they want to have an appointment in their car. As long as they're not driving, that's fine too, wherever you feel safe and comfortable. Like, so that's a big difference between going to a doctor's office, where like the whole thing is kind of set up for the doctor and not for the patient.
And I noticed too that Dunn accepts insurance and flexible spending accounts as well.
Yeah, and I think they keep working on that more and more, so that hopefully that will expand. Yeah, where it really done is about access, like really,
Right.
and anyone who wants, we do our best to help people access the care that they need in the space and the time that they want. So we really like, there's when Dunn was founded, we really wanted to have a patient first philosophy, and I would say we definitely do. Like, we can't always make everyone happy, because sometimes people want things that aren't good for them. But in general, the focus is always on, like, we're helping to help you access care or ask questions or whatever it is you want in a space and time that's convenient for you and private, and also shows respect.
And yeah, I also noticed the membership plan, which I thought was really fantastic. Membership plan, and then really a very reasonable rate for once a month rate, because I think it mentioned on the website as well, a visit to an office can be very expensive.
Yes,
and this was actually,
especially if you want to see a specialist, especially, like,
right.
And there also aren't enough of them. And as I mentioned, if you live even in a fairly populous state like California or Texas, I know that even as a resident, we used to have people, I was in Los Angeles, we're driving from Bakersfield, which is at least an hour and a half, just to come see a resident. And that, not that we weren't good, but that's not even a fully trained doctor, because that was the best access to care. Whereas now people can be whatever part of the, hopefully in one of the 35 or 37 states, and can find someone who's convenient to them, where it's not involving a lot of driving. And
Yeah.
Well, we'll make sure to put the link to Dunn in the show notes, so that people who are interested in learning more can get the link right there. Thank you so much, Dr. Martinez.
Thank
We
you.
appreciate the
Thank you.
information.
Yeah,
Thank
we
you.
always learn so much. Yeah.
It's been lovely speaking with both of you. If anything else ever comes up, please keep me in mind. You know how to get in touch with me through Joanne. So, all right.
Yes.
Thank
Thank you so much.
Thanks. Have
All
a
right.
great day.
You too. Bye.
Bye-bye.